Ene ngatai palliative care zerkan bachino juna napari ngatai zuchi wan le gaun khampa ngatai care goskan khampa ta to mangpor goskan digon pane gazuk sing ngatai petana ngatai suji deep ten na paralysis sana hale ya den so la mi de zuma no kharne zuma cancer zuma zerkan ju ngatai satok na mo pe gosan hale gaun nam chupa ta ngen kan hospital boron banching na hospital na chuti ta chi tene khampa khos ta ko mo por gosan eso mulla ta care chuches mulla ta khampa su sosulten hale dena chokla khampe miulla gaduk si kon ta tok chuches deul hates gaduk si fen de skor kon ta palliative care hale deus ke pasang ta palliative care pinala drinks kon ta services ma gyalek ta ka kul matu be deus ke pasang dring ta Cipla foundation na HelpAge India ta company is kon rock sang ko ta ke palliative care team ji chuse doctor nang nurse nang physiotherapy na samai ngata team jik juspa ene ngata ye hospital skut kan te so skan ulla khos tan ulle chi bose te samata no ene te kana nikana chuti da chi khampa chi ju chen kampe la laban khorau chko te akasik sam sam
Vale, palliative care pia tene la rin meta ina to.
kasa inokle rin met pa ta ka ikan hospital la jok ta ko thobini no pale khampa ngata doctor care gos na nurse care gos na khampa ngata chi care gos na te sama ta rin net to thobya kasi
Mang chapka to patient mulla go sano ka de care.
아, palliative care pongata mangfat unit changna ko samya innang neurological diseases ta dibyo kan so paralysis sakan te wala mangpor ko samka pa ta ta ko mo ko sa tena so la ta psychological diseases na ta dring ke japa na ta semba mate kan zumo down lu shi on hospital care in the hospital chamet kan down kan hal या तेव्हा सम्मा मागतो ना गप्पूर गप्पू मा मागतो येतो लाईक काऊन लागत हॉस्पिटलला चेन असेल छामेत जसे खरं छाईन मिळवचे या नका खेरीन समजा खिरचेस तो कास्ता घेतो आले गाडी ना अजून मी यांचं कंपनी थिंग होत असतो तू kan मा मागतो कसं
Tena to sa da suji ya na tariga takan men na zumu yung si yul digna.
Oh.
Te to so na I palliative care ki ya ta to kon la lobster ni.
ino tantan ino ju palliative care ko matan ju sino le tok met takan met na teon ta hospital khose palliative care ward na khose bona diksen ta hospital chi sar nam sang ta hospital ta ya banji gors pate ke na the bed to things young patient dik le pa bed thing gors यो फिंग ना ते कना ता yang private ngata jaga rik chen jotle garu ngata tu zri ri borian yo ngata injury chona spesi juna dring ngata ngata ame palmole ngata am chi jukse lo hale koi ladab nan so sisin nanku ko palliative care center chi jukse om ngata be ke shift chona tene korang am chi jukse korang ta jukse no ko tene ngata doctor ri volunteer ngata akas ko kan yoda yote temen ngata palliative care ngata hospital la chose kan ko tena team ko akas ko designate kasi
Vale, I palliative care service ko ka patient zache se chaji
kasa ta yo gozuk chi ya ta chi chi gosan ko yo agar nale goma ta doctor na nurse jukta ta hospital la tangin ta yo men ba ko ta volunteer na ta farang santat mi mangpor gosan gaon na ta mimang si thwa ta sta na le mi idui na ta la rok chu cher ko kan no po ta le so yo ta platform ti madu pasan ko ding ma na Diri napang aja tundus pete jenuh le nata I toksi napang le rocks jenuh kan sama platform cik cik zones te. Legata medically background men kan cina kau sapik cik test korla siap te how good te training tansi. Dene compound la nata se service na in hospital la patient countless cases na te toksi rocks te sama thorna nata se ike chala jadi le. Diri napang aja issue sum cik mi ke last jenuh kan yoda medical men kan. Diri kata jumps sewe thokna demba ngata napa jipsi jin samkhani mi demba ma mangko ekte dule ene khong sangma ngata platform thokna dena man ma pek ngata yong na ene ngata tharing spine do ngata yang su ngata medical pa malep sa yukan te sangma ngata abuse cha jik sangma rock slap nyan chukchan kasu injury
Together, the shared vision of Cipla Foundation, HelpAge India, and the Health Department of Leh. We are incredibly proud to share that this vital initiative has been established with the due permission and benevolent support of the Office of the Lieutenant Governor of UT Ladakh.
In the high mountains of Ladakh, distance is not just in kilometers. It is in pain, in loneliness, and in silence. For years in SNM hospital and in the villages of Ladakh, we saw the same story. A patient diagnosed with cancer, kidney failure, or any other chronic illnesses, the treatment would continue. But the pain, the fear, the question at 2 a.m., what next? What will happen to us? What will happen to my children? Had no answer. The caregivers suffered too. A daughter who left her job, a son who became a full-time nurse, a wife who had no one to talk to. Medicine was treating the disease, but who was treating the person? It began with the virtual meeting with Dr. Monisha Emma, Cipla Foundation members in the month of March, April last year.
For many of you who don't know, my grandfather started Cipla, and that commitment that we have in the family to healthcare has been there since close to 90 years. For those of you who don't know, Cipla is actually celebrating 90 years this year. So that commitment to healthcare has been fulfilled. And actually, when I spoke to Anurag Mishra about coming to Ladakh and doing something in Ladakh, I said palliative care. And nobody really questioned that. Nobody said, Manisha, why palliative care? Why not working with the environment or working with clean water or working with anything else? I think you never really questioned that. And I want to tell you today why I said palliative care. In 2005, I lost a very dear friend in Leh to cancer. By the time he was diagnosed, he already had stage 4 stomach cancer, and he was given barely 6 months to live. I saw how both he and his family struggled, and they had to cope not only with the emotional pain, but also they had to make him comfortable and with the pain that he suffered. He actually spent his last days of his life here in SNM hospital. And I think for me, setting up this palliative care center here is in many ways a dedication to him and in honor of his memory. He was from Tikse, his name was Palber Goma.
I'm very grateful to the entire management staff, doctors, the consultant, the nursing team, the social worker, the volunteers, and the community members who are present here for this auspicious day of the launch of this project. And I think, something which Monisha mentioned, that 90 years Cipla is completed. And when I was reading about SNM Hospital, I realized July 1976, 10-bedded center was established. This is exactly 50 years back. That's how it all started. Exactly 50 years later, we are starting with another milestone in this hospital by putting up a palliative care center.
As HelpAge, we are delighted to be part of this opportunity to make a contribution. As the name suggests, Help and Age, our focus has been on senior citizens because of aging, how it intersects with development. And we run many programs across the country, but focused on disadvantaged elders. So while we are present in 20 plus states, our presence in Leh and Ladakh holds a very special place in our heart. We started our work in 2010 during the landslide disaster and later built what's called as the Leh Elders Village as a senior citizen home in Sheh Village with the blessings and support of the Sheh Panchayat and RECL, which gave their CSR support. Of course, this would not have been possible with the support from all stakeholders across the Leh Ladakh region, and our gratitude to them. Situation of palliative care need, how will they access it? How will they reach out for that gap between pain and a compassionate care? And that is where the community-based aspect brings in a lot more relevance, not only in Ladakh's context, but in overall.
Because we are going to, courtesy Cipla and HelpAge, we are going to see a palliative treatment here. I also come from another hill state in Northeast, where I don't think we have even started palliative care, even though the incidence of cancer and stroke and even kidney failures, dialysis, these are very high. So I'm really happy that we are starting here. And special thanks to Cipla and HelpAge. I can commit on behalf of the Chief Secretary also, all possible support for this palliative care unit. enough has been said about palliative care and how important it is and the gap which it will fill. So since it's highly technical, I will not add much beyond that, and I don't know how much to add also. Just one suggestion. We have an alternate system of medicine here called AMCHI system. So even we have a unit in this hospital also. They are also into palliative care. So I think they are doing quite well for stroke and other other terminal illnesses also. So if you can take some inputs or see some collaboration with our AMCHI system, it would be good. We even have a National Institute of SOA, which is an autonomous institute under this one, Ministry of Ayush. They get a funding of 50 crores a year. It's a very big institute here. So, and in the salary component, they spend only around 8-9 crores. So the rest they do this work. So there is a very good chance of collaboration with the system also. So I'd invite you to that also. Then I'd also like to congratulate the health team here headed by Dr. Finlay, Dr. Rinchen, and the medical superintendent, deputy medical superintendent, and all the staff. We are going ahead, and let us all work together for a better and healthier Ladakh. Thank you.